Hello and welcome to HealthCast 305, Miami and South Florida's #1 health-related talk show and podcast, with a lot of Miami guests and sometimes guests not from Miami. Sometimes guests that have been in Miami before in the past, so that counts. And they can provide great
Hey,
information. That
yes,
counts. Also from warm places, that counts.
yep.
Today's guest is Rachelle Cherryholmes. Um, that's not the name I knew her by in school. She's a
Oh,
phony. She changed it because she got
oh
married.
man, I leveled up from four-letter last name to an eight-letter last name.
Yeah, that's true. You doubled
Oh
up.
no, maybe it's more. I think it's more. I think it's 12.
You never counted the letters?
No, I can't. I have to. I can't fit it on a line. It like looks like cherry, and then it goes home,
Yeah,
and I can't
yeah.
fit it.
It
It's
is a
really bad.
crazy combination of names. It looks like there should be
It
a
is.
hyphen between Cherry and Holmes. Like some point they just dropped it. Well, Rochelle is a doctor as well. She's a doctor of physical therapy. She graduated in my class with me in 2017 from University of Miami,
Mm,
and she went on to go deeper into this pediatrics realm, working with kiddos,
yeah.
because she's such a great person, and you have so much patience, you know. So she's perfect with kids. You know, she has a kid of herself of her own. Maybe she'll have a few more.
Maybe.
Um, maybe we don't want to
Maybe.
jinx anything. You should create as many versions of yourself. That's how it's supposed to be. Um, but she works at Phoenix Children's Hospital, which is one of the biggest children's hospitals in Arizona. So,
Yeah. Yep.
yeah, she's no stranger to this stuff. She's a pediatric physical therapist who works in a multidisciplinary pain clinic,
Yep.
and she's particularly in the pain program itself, where she takes kids through some intensive courses for pain. Can you tell us a little bit about these intensive 8-week courses for pain for these kids? What's that all about?
Yeah, it's so fun. Okay, so usually when you say pain in the pediatric world, people are like, like it's hard. It's very hard. This clientele is very hard. It's chronic pain, right? Like a
Hmm.
lot of people shy away from chronic pain anyway. Like there's just so much that goes into it. So we started this pilot. We're basically piloting it right now, but we're taking it super seriously. But we like picked the three patients that we are taking through the program. Like they were handpicked because they're super serious about getting better, about going through psych. They do. There's a pain psychologist. We actually have at Phoenix Children's, we have two pain psychologists, and they are the only pediatric pain psychologists within a 400-mile radius
Oh my
in the
gosh.
Southwest. So if someone in Arizona or New Mexico wanted to needed a pediatric pain psychologist, they needed to either go to San Diego, I think, is the closest one, or Texas. So we got really lucky, but we have Dr. Mark Popenhagen and Dr. Ari Zakarian, who is from Miami.
Well, another
Yeah,
reason
yeah.
relevant.
So he's out here, but yeah, so we have this like we already have a multidisciplinary clinic where they see a like a we call her a pain doctor. We have a couple pain doctors at PCH, so they're MDs who specialize in pain along with other things. And then we have a pediatric pain psychologist specialized on the team, and then we have a pain pediatric physical therapist who's on the team. And so what the pilot program is, we call it the WRAP program, WRAPP. Um, Still in its infant phase, like very infant, like we're still working on bugs, but like we all have kind of a curriculum that we're going through the 8 weeks and set goals. Like so Dr. Genovese, she's the MD, she has set goals. Dr. Ari Zakarian, he has his set goals for psychology that he's going to get through and retraining that whole body mind connection. And then I have my partner and I, who are down at the Gilbert Clinic. That's like South Phoenix, the suburbs. We have our goals that we're like physical therapy wise that we're getting our patients through as well. And we all work together. So we all meet up at the beginning of the day and at the end of the day and talk about everything with these three patients. It's awesome. It's so cohesive. I love it.
Yeah, that's the key, right? Is working with
Yeah.
people in teams. So you have like your little subject, your little kiddo, and then everyone can talk about what's going on with them, and then you can all help each other out. That's a
Yeah,
huge
it's
part of making a successful plan of care for someone. I
oh,
worked in
it's
a
so
hospital
great.
before, and when they had that, it just seemed so much better for them. We had like team meetings. It'd be like, this guy, everyone, what's your word on him?
Yeah.
And they would all figure something out together.
Yeah, and well, and you take in their environment, like what's their social situation, like who do they live with? We have a couple, like are they moving? Like how are they doing with COVID? Moving schools, like so it's so cohesive. It's such a great snapshot of the patient. And I'm not talking with people over email because it's so hard to talk. Like it's email's hard. Like it's great, it's fast, it's fine, but like it's great to talk over Zoom or the one-on-one. It's so much better. So we get to do that. Every Tuesday is pain clinic for us, at least down in Gilbert. And I have a blast. It's so fulfilling. I love pain is so complicated. I love the research behind it. I'm willing to say I don't know everything. I probably will never know everything about it,
Yeah.
but it's been so much fun to dive deep into just the bare minimum that we were handed in school and to just go deeper into it. And like we went down a rabbit hole this past year, like in the physical therapy section of it. Alexa and I just went down this huge rabbit hole, and like our minds were blown. It's nuts. Like neuro
Yeah.
pain science is nuts.
Yeah, it's something that we don't learn much about in the didactic part of school,
No,
but you end up realizing how important it is, and it doesn't really fit into any model perfectly, so it's its own model.
no,
So we got to look at things from multiple perspectives. You got to look at the biopsychosocial components of it. And I was looking at some of the research you were doing, and I was like, yeah, this is right up the alley here. So starting with some of the things that you were talking about, um, there's the traditional pain model, which is like what I think most people think about. Most people,
right.
when they're in pain, have this concept of the traditional pain model. Like, how would you define that for like the general population? With like how like what do you see like when these people come in? How do they view pain um, initially?
Oh, it's so hard because like we learned that in school, that statistic of where like what becomes general knowledge is has been in the medical field for like 10, 15, 20 years. It's already 10, 15 years knowledge. It's old knowledge. So we're
Yeah.
still in this gait pain theory, um, like context of how we view pain, which is not wrong. I'm not saying it's wrong. There's so many different ways to view as pain, but the pain gate theory falls very short because, and this is how, like, when you first, like, so when I used to get patients who would come through my clinic who were in pain, who had chronic pain, pain outside of the 4 to 6, 8 week window, right? Because we know all tissue healing is usually within that 8 week period, right? So it's chronic
Hmm.
pain after
Yeah.
that acute phase. After, I think it's greater than three, no, six. I think it's now chronic pain is now defined as greater than 6 months, right? I'm pretty sure. I have
Oh
to go back
yeah.
and look on
I
that. I
always
think it's
yeah
greater
I
than six
always
months.
Okay, wow.
But
I've
but for
heard
me, but
three, but
for
this must be longer now.
right, but like I'm in a clinic and I have to work with what I have. So I like if it's longer outside of that 8 week, 3 month window where like tissue healing, the bone, all that stuff is already cleared through. It's
Yeah, that stuff clears up
right. It's
eventually.
it's chronic pain to me, especially in the pediatric world. But
But
because we
like
have to get
anything
on
else,
that.
there's not a defined line, like as we
Right,
know,
right. There's
right?
no defined line. So if someone wants to correct me on that later, go ahead. I won't argue with you. But we'd get these kids who'd walk through our door for a
Yeah.
pain eval, just physical therapy pain eval, and you start talking to them like, how did this, like, where, like, tell me, like, you go through the whole thing. Tell me about your pain, like head down, and sometimes there's not a physiological reason why they have the pain. And that's where the pain gate theory falls short because they'll just be like, I don't know, one day my back started hurting. Well, did you do anything to your back? No, it just started hurting. Okay, well, like, tell me about what happened that month. Well, my grandma died, and then I got really sick. And so then you start kind of talking about this mind body connection. And then sometimes parents will look at you like, are you on drugs? And then you'll start talking about like pain psychology and multidisciplinary approach, and they're like, hold up,
Yeah.
hold up. Are you calling my kid crazy? But it's not, because what people don't know about, or what's not common knowledge, is what they started doing in the 90s was that like organic pain model of that looks at your environment, your psychology, like what's going on in your head and your body as well, because sometimes people are more disposed to having, you know, a lower threshold of like the conduct, you know, like nerves, like how they fire. It's shown that some people who are more um I'm brain farty, but people who are more disposed to have chronic pain, because there are, you know, like genetically, some of us are wired to, you know, on genetics, like if something environmentally exposes that genetic,
Yeah.
you know, like you get chronic pain. And
Just like
so some
anything
people,
else.
just like anything else, right? Cancer, I don't
Yeah.
know, you know, any chronic disease. Sometimes they have a lower threshold of like of their neurons firing, and you know, like it just something triggers one day, and you know, like they just are in pain.
And you were
So
mentioning the like this, like you were mentioning some stressors and stuff too, and that this is where I've heard something before, and I'm sure you've used it, is like the cup theory, the overflowing cup.
yes, 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 yes. Yep.
Yeah, like the cup itself is your tolerance for pain, and then the water that you're pouring in it, or coffee or milk, or almond milk, is
Almond milk,
the yeah,
oat
I'll
milk,
do almond milk. Yeah, this person's lactose intolerant. That's the
probably.
those are like this those are the factors, like the intrinsic factors that lead to pain. So
Right.
so if you have a lot of things, all of a sudden, you know, you're operating at this level where you have a disc herniation, but it's not hurting, and but you're not that active, but you don't have any pain. And then all of a sudden one day your mother-in-law passes away, and then you got to drive to her funeral, but then the car breaks down, and then the economy crashes, and you had stocks, and it's kind of depressing. And then your dog pooped in your shoe, and so you bring the sandals to the funeral, and that's just a bad look.
It's just
So
awful. You look
yeah,
awful.
then social suicide.
Yeah.
Um,
Why are you
and
even here?
then
I don't know.
yeah, don't even go. You'd be
Don't
better
even
off
go.
not
Just go
supporting
home.
my mother. Don't even come, and then your
Nope.
wife divorces you. So that's the sequela, and then that's so much water, that's so much almond milk overflowing in the cup, and when that overflow happens is when you can describe it as this episode kicks in where they're in pain, and now it's like
Yeah.
now getting out of it is like a whole battle, you know.
Right.
So and with this, so when you mentioned pain gate theory, just to clarify for the listeners, that would be what you consider the traditional model of pain.
Yeah, I would like what people when they describe, because no one knows, like, you know, and no one in pediatric or outside of, you know, no one outside of like physical therapy or like a medical doctor knows. Like if I had a parent come in who's like a business or an engineer, they can't tell me, oh yeah, the pain gate theory. But like when they describe to me how they think of pain, that's usually what it is. You know, like a certain nerve fiber, like, you know, like they tell me, you know, they tell you in
Yeah.
like common knowledge lingo, but you can match the stuff of what they're saying up to the pain gate theory. It, you know, it triggers a certain nerve fiber. The fiber runs up to your brain. It signals pain. So how do we stop it? We cut the nerve fiber, or what you can't do, you stimulate something else. You know, like the low threshold, that the what you usually want to
Yeah.
stimulate the longer low threshold nerve fiber. I don't even work on that theory anymore. Like I'm not even on that level anymore. I'm like, you know, I'm out in the real world clinic stuff. So like all our focus is to get these kids back to their normal lives. And you know, like I'm just the start. I always tell them, I was like, I can't get you back to where you were like doing yoga 5 times a week, because they're so deconditioned. Like literally it just they come deconditioned. So all we are is trying to get that pain level to come down, their activity threshold to increase, to try to desensitize their nerves and their brain and that pain center in their head to just die down, so that they can get a little bit more activity, because it shows that the more active you are, the less pain you're having, probably because all the neurotransmitters that you get from exercise, you know, the emotional release, the community you get, you know, like all we are is trying to get them active again.
Yeah, that's the thing. Most people want to just do nothing when they're in pain, right? That's the
Well,
initial.
that's what they do. Like I'm like, tell me what you're doing right now. And usually when they're in pain, they are sleeping 12 hours. Their circadian rhythm is completely opposite. They're not drinking water. I don't even know what they're eating. I don't even want to ask. Probably not nutritious stuff. You know, like they're just, you know, like they're just and you can't blame them. They're just trying to get by. You know, they're teenagers already. They're going through changes. You know, their family, whatever's going on in their family, like you can't blame them. But like we at least try to get them with a solid foundation of how to launch from us. Because I always say, like we always say in the pain clinic, we cannot promise you that you will be pain free, but we can promise you that we're going to give you the building blocks to get your life back to where you want it to be, to get you to your goals, to get you functional again, to get you independent again. That's our goal. That's always the goal.
Yeah, a lot of times the pain will take care of itself from there on out. Because if they
Yeah.
fix their sleeping, their drinking, their eating, their environment, then they're more active, they're getting back to sports, and they're a kid, like, I'm going to guess that the outcomes are very good for them in general.
Yeah. Yeah.
That's what I would theorize at least. Um, so do you work with any adult? I mean, you don't. So you work with pediatrics all day, all week, correct?
Right, but pediatric, like people are like, oh, what ages? Like literally, I am working from like kids 0, like 2 months old. I think my youngest one time was like 30 some odd days old, to all the way.
Oh.
Like pediatrics is so gray area, but sometimes we get like kids who are 25. You know, like it's so gray because they've been with that doctor for so long, so they're just like that in between transition. Don't even get me started on that. The in between transition from pediatric to adult care, chronic care, it's hard. It's super hard. Because there's no one to help you get there. They're kind of just like, okay, bye, see you. So like a lot of times we just, like they just had this doctor forever, and the doctor's comfortable with still seeing them because they know him so well. So we have kids sometimes who are in their 20s.
Yeah, that's always a sad transition. I remember leaving my pediatric doctor.
Yeah, me
Um,
too. It was
I was like,
awful. She told me, she's like, okay, bye. And I'm like, what?
yeah, you knew so much about me.
Yeah, where do I
Yeah.
go? You know what my pet dog's name was. Where am I going now? You don't care who I am. Like, what do you mean bye? I know it's so hard. Pediatric to adult, that's a totally different discussion. But I even went to a lecture about that in Miami when we were in physical therapy school at UM.
Hmm.
I went to a lecture about that and how they're dropping the ball specifically with kids who have kidney issues, like chronic kidney stuff.
Oh.
They like how the death rate increase. That's another topic. That is, I'm getting
On
off
the
track.
transition, so basically on the transition from going from pediatric to like
An
internal
adult.
medicine doctor, like it becomes they drop a lot of the important things they've been keeping track of for years. Is that what
Yeah,
you're
well,
saying?
or they don't know where to go. Like parents are just confused. Like you have this whole slew of people at your children's hospital. You know, Nicholas that you guys have down there. You know, you have this whole slew of people behind you, and then all of a sudden you age out, and like, okay, now where do I go? Like they don't know, and it's because like at a pediatric hospital, it's so great, especially with Phoenix Children's where I go. It's like, oh, you have cerebral palsy. Okay, we need to get you lined up with a neuro. We like they do it. Like that's just how we do it. Like we line you up. We don't make you guess of where you need to go. But then when you transfer to adulthood, it's kind of like, okay, good luck. Hopefully you know where to
Yeah, the
go.
multidisciplinary thing is good. The more connections you can
Yeah,
make between the departments is
that's
what
why
makes it successful.
I love it. Like when I first started and I'd get the pain kids only just with a PT eval coming from the community, like their pediatricians, like, I don't know, go to a PT. It was so, our outcomes, I feel like this is all like subjective. Like I don't have any objective data on this, but for me personally, it is so hard when you are trying to do it yourself, because literally sometimes every week you're having the same conversation about the mind body connection, about how important your mental health is, how important it is to do all the mindfulness techniques, the quiet time, the all the stuff that Dr. Zakarian and Dr. Copenhagen teach these kids, the psychologist stuff that I am not clinically trained for, how hard that is to explain to a family when you're not a psychologist. It's like beating your head up against a brick wall because they don't buy in. They can't buy in because you're not a
Yeah.
psychologist. I don't know how to explain it, right? I can tell you PT stuff all day long, function, research, pain gait theory, the neuroscience
Yeah.
neural matrix model. Now I could tell you that all day long at a common level vocabulary, but when it comes to psychology, I have a minor from Arizona State. Like that's how far I got. And so when these parents look at you like you're crazy, but like you can't get far just being a PT alone in the pediatric pain world. Probably adult world too. You need that multidisciplinary thing. You need it. I love it. It's so great. It's so awesome.
So these things that the physicians are coming up with, do they expect you to invoke them with your treatment of the kids? Like,
We Oh,
Because some of those techniques can be mixed in with PT. Have you guys been working on like
yes,
ways?
yes, yes. So like we created this working Word document that we do for our pilot program, the RAP clinic, of
Mm-hmm.
common terminology that we're going to use. So like Dr. Ari, Dr. Genovese, and me and Alexa all pull from this document to try to keep the lingo the same so that we don't confuse them. Because if you switch up a
Yeah.
term, they're like, wait, what does that mean?
Yeah.
I'm not used to that.
Then they don't buy in anymore. That's the
Right.
thing.
They're kind of like, wait, I'm getting confused. So yeah, so we all, and we're all, we will, before COVID, we would all go in together, at least the MD and I, we all go together to present a united front to kind of tell them what this pain model is, how we're doing it, what it means to be a patient at Phoenix Children's, what what we're kind of expecting of you to show up, like, because you need to show up, we need you to show up. So we kind of give that to them so that, just so that, like, they're not caught off guard, like, what you mean I have to come to 2 appointments a week, like, where you, like, like that kind of thing. And then Dr. Zakarian will do his thing with the patient, and then Dr. Genovese and I will eval the patient together. So we're all on the same page. We talk about it at the end of the day. We're using the same lingo. We know who we're talking about. We actually, I think I talk to them weekly. If like almost daily, I'm in email chains with them too as well. And we'll call each other every once in a while if they check up on a patient when I'm not with them. So yes, we are all on the same page. We all cohesively get on the same page.
What are some of the so you guys all work with these kids? What are some of the most common chronic pain things you see in kids? Because this is an interesting topic. That I mean, chronic pain in adults. We see a lot of
Right.
low back pain. We see a
Right.
chronic knee pain, and people come
Yep.
in with the same things. It's bone on bone. It's I can't bend over forward. The disc is gonna pop out and destroy my back. It's gonna be an explosion. And then so it's like the same. What is how does that transpose onto kids? What are you seeing with kids
A lot
with
of
these chronic pain issues?
a lot of what, like, just basic of what you will see, like I don't want to call it textbook because it's not data backed, but what we see a lot of, what my coworker and I see a lot of in our PT evaluation is headaches, um upper trap pain, like they'll like sharp shooting stuff because they're so here on their phone all day because
Oh
they're not
gosh.
because they're not doing anything. They're either sleeping or on their phone because, like, I'm in pain, like, it's I don't want to move, I'm in pain. Like, that's the opposite thinking. Like, we have to retrain them with, like, movement is good. So the upper trap pain, usually like along the rhomboids, like in between your spine and the scapula. So that, that rhomboid area, that will be painful and very, like you can pick out the trigger points and be like, oh, yep, 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 yep. So very trigger pointy in that area. Usually low paraspinals are always tight. If they don't report it, you always find it. Like thoracic lumbar paraspinal is usually tight. um you'll find a lot of, so they'll complain of headache, shoulder pain, they'll call it shoulder pain, but it's really upper trap and rhomboids. They'll have this like aching, some of them will call it like bone pain, like deep achy muscle pain. Usually you'll find that kids who have hypermobility, because their ligaments are so lax that they rely on the bulk of the muscle to stabilize them. So I get a lot of hypermobile kids, like EDS, or like kids who are on the hypermobility spectrum who are in chronic pain as well. So I see a lot of those. So that is a common thing, is like these kids just skipped over because they're just flexible. So they started cheerleading, and then all of a sudden, like, puberty hits. And so this is interesting about chronic pain. So hypermobility is a big theme I see in pain clinic, is because these kids, the ones who are like double jointed, they'll be like, in elementary school, they'll be like, look
Yeah,
what I can do. And you're like, oh. So when you hit puberty, guys get testosterone. So their ligaments get stronger because testosterone is like what is a hormone that will act on ligaments and make them stronger. Right. So usually less flexible after they hit puberty. Girls who have
for strength.
hypermobility or on the hypermobility, they get oh my gosh, estrogen. Ugh, they get estrogen. Estrogen makes ligaments laxer, right? Because we're women, right? We bear children. We have to be laxer. So they get even more flexible.
Oh
So they're
boy.
the people who are stunting and cheerleading, who can do the splits, like, or who aren't even active and can like they'll be like, oh, watch this. And they can do like party tricks with their shoulder, and you're just like,
Yeah.
ugh! So that's what I commonly see is a lot of hypermobility. They'll complain of like bulk pain, like bulk muscle pain. The kids who are just chronic pain, they'll complain of like calf pain, ankle pain, a lot of like everything's hard. I can barely like walk from my classroom. Like the common theme is they don't go to a brick and mortar school. They move to online school because they literally cannot make it through the day because they don't have the energy. Like the cup theory. So the cup, like their cup is so full, you add more activities in and they're done. Like they spill over, they can't do it, and that's why they're sleeping for 12 hours because they can't handle it. Like they can't handle the extra activity because they're in so much pain mentally, physically, they cannot handle it. Hormones going biologically can't handle it. So that's what the common
That's
theme you
true.
usually
Yeah,
see.
puberty is like a huge traumatic event
Oh,
in your life.
huge. Like we don't even think about that. But I always ask, okay, so and it's always in the paperwork too. We hand them like a pretty thick, like 4 or 5 page like fill out form to like just so that we can glance over to kind of get like a better picture of where their pain's at. Like we have like a person who's about this big on the paper, like front and back, and they circle where all their pain is. Abdominal pain, you see a lot of abdominal pain in kids who have chronic pain, and that's a theme. Like, and it doesn't come from a stomach ache. It's just it's there. I don't know, call it anxiety, call it like I don't know. I don't know what the etiology is, but they usually always
Wow.
have abdominal pain.
So we're
Like
not sure why it's there, but so how do you go ahead and treat something that's because I know with kids, I mean honestly, when I treat pediatrics that have those kind of conditions, that would be like one of the tougher patients for me for sure.
right there, and this is the thing, Rob. This is the thing where I got out of school and I had to learn, and it was such a curve for me because my dogs are gonna bark. My husband just got home, so sorry guys.
It's okay.
Hopefully they're
That's
quiet.
every part of like a Zoom call. You need the dogs barking.
I know you need the
That's
dogs, right? The pit bulls, like both my pit bulls are like, oh, they're home. So this is the thing that was such a curveball for me that really threw me, and I hate to look back on it because you know you learn as a clinician, you know it's a practice, but like I'm looking back, I'm like, oh, I just messed up. Like that first 3 months of like 3 to 6 months of being in the pain clinic, and me having to read all these textbooks and doing research on the weekends, I probably messed up, but the thing that you're finding in PT research with for pain, as well as like any medical pain research, chronic pain, there is no answer. Like I can't tell you, oh, that one time you were jumping on your Aunt Betty's trampoline and you busted your knee. Like I can't give you like like I can't give you a tangible
yeah.
thing. Like and that's what they're
That's
hoping for, and that's what gives them hope is like, oh, this is because of this, and they try to link it
hmm
back to something, and I can't
yeah.
because
That's
it's like, yeah, I can't. Like, yeah,
that
maybe you
happens.
had a
That
it
happens
happens all the
with
time.
my patient. I mean, obviously, like the classic patients, like you have like the 15th appointment, and for like 13 appointments in the row, they'll be like, "Why does it hurt right here though? Right here,
Yeah,
why?"
right here,
And
and
I'm
I
like,
can't.
"Yeah." You give all different types of answers. One day you might tell them, "Well, you might play like the I don't have imaging. Well, I don't have X-ray
Right.
eyeballs, but." So we're treating how it presents, and then the next time you might say something like you might give the whole chronic pain neuroscience education rant, and that might be good enough to hold them over. But in the end,
Yeah.
people with chronic pain, they always want answers, and like they
Yeah.
can't. They want to know why this exact pain is happening, and it's so hard to just be like, it's difficult, and people don't
Yeah.
want to hear that either because there's no answer
No, they
to it.
don't.
The old model was so nice. You could just
I
say,
know, right? Touch
the
a
disc
fiber.
is. Yeah.
Yeah, we're not gonna stimulate the A and C fibers anymore. We're gonna go for the low threshold nerve fibers. We're gonna do some manual. We're gonna do some. I don't even have modalities at my clinic, to be honest. I don't use any modalities
Me
on my pain
neither.
kids. Sometimes I will tape them. I'm not. I'm a fan of kinesio taping. I don't go tape
Yeah.
everybody, but sometimes there's a purpose for it. But but and sometimes they're on gabapentin, which is a neuro pain drug. It can be used for pain. So sometimes they're on gabapentin. Sometimes the MD will see it fitting that they get on gabapentin. Some kids will come to us and be, I don't want meds. We're like, awesome, we don't have to do meds. That's your choice. But back to like the reasoning. That's why parents are coming. It is so hard. Like there's some days where I'm going home like stressing out. Some days I cried in my Durango, because
Oh,
these parents, well, these
sounds like
parents
a
come to
country
you and
song.
I know, right? Driving home my Durango in Arizona down the freeway with the
Sometimes I
monsoon
cry
coming
my
in.
Oh, sometimes I
So
cry
Arizona,
my
all I need
Durango.
is my cowboy boots. But it stresses you out because these parents, like, they see their kid in pain at home, they see their child not doing what they're normally do, they don't participate in family activities anymore, they're depressed, and the parent is coming to you wanting an answer, and you
Yeah.
literally cannot give them an answer because but this is, and it's so much parent education too, and I've probably offended some people, which is okay, like, it happens, we all offend people, like, that's what happens when you work with people. But you have to educate the parent. This is what I don't do, Rob. I'll tell you what I don't do. After evaluating them, I never ask about their pain levels ever again. And that's the one thing that the pain psychologists have talked to us
Yeah.
about is redirecting, mindfulness, connecting the mind body again. Movement is best. Like, I know you don't want to, like, and all the kids will be like you said, I have pain so bad right here. Oh, I'm so sorry, Jimmy, but guess what? You know what? Let's get on the bike and you tell me about your week. Like, that's how I redirect. It's constantly redirecting, constantly encouraging
Yeah.
them. Do your homework, do the homework that we give you, the exercises, do the abdominal bracing, do the deep breathing, do the progressive muscle relaxation, giving them all these tools for their toolbox to do throughout the day and at school, so that they don't think about the pain anymore, that it just kind of, everything else brushes that away, because that's what we're combating. Like, it's physiological, it's mental, it's environmental, it's so much,
Yeah. So you mentioned progressive muscle relaxation. What's that
yeah.
all about? Let's hear
So
that.
it's
That
like, it's
sounds.
through an app. Yeah, our pain psychologists use it. It's through an app, and it, like, and we learned it in school. I think it was, oh, what was I forgot whose class it was, but it's like progressively, it's almost like yoga, where you lay there at the end in yoga and the
Yeah.
instructor's like, you're sinking into sand, and you, like the progressive
Hmm.
relaxation of your muscles. Like, not like, I'm not going to just sit here and be like, okay, relax quads. Okay, relax. Everything just relax. Okay, just loosey goosey. Like, you can't do that. You have to, like, like,
I
strategically
command
take
you
your,
to relax.
yes, please relax now. I'm gonna go get massages because I can't relax. I am the worst patient ever. I cannot relax.
I always think
So
about, I'm like, how much time is left in this massage? Like,
yeah,
is it like 40 minutes or is it 20 minutes? I'm like, it's going to end soon. This sucks.
yeah,
I need to get a
you're
massage where I determine when it ends. Like, it could be 3 hours. And I'm just like, okay, I'm done with you.
yes.
But
I know. I don't even go to anybody. Like, if something happens, I'll just have, like, Trevor. I'll, like, be like, hey, you need to press at this muscle for like
yeah,
3 to 5 seconds.
it's so
I will tell you when to
functional.
stop. Yes,
It's
just do
not
it.
fun.
No. And then I'll be in the bed squirming like, oh, I'm the worst patient. I'm literally the worst patient.
Yeah,
It's
everyone
yes.
wants, like, oh, they want PTs. Oh, can you massage me? And it's like, yeah, like, but my massages are like so functional and like they're
Yeah.
not fun. It's like I'm gonna dig my
Yes.
thumb in here and you're gonna do some active movements and it's gonna
Yes.
reduce your pain. But like
Don't
that's
ask
not.
me.
They're not gonna get like a nice like effleurage, like a,
Yes.
what do they call that?
None of
Tree
that.
hands.
I haven't done that since year 1, year 2. I have not done any of that.
Yeah, I can't even. In my clinic, I couldn't even pull that off. It would be
No.
gym goers. I guess maybe in the in-house private stuff, but then I just become no. Then I'm a masseuse. Come on, I'm a PT over here.
I know.
So yeah, with progressive muscle relaxation, it sounds like it's and this connects right back into pain neuroscience because we're using the mind to gently relax the body, and you're creating
Right.
connections, and it's not a bad experience. It's a positive experience, and you're not even
Right.
having to move. So it's a great way to do something when there's nothing else to do, and you can do it from laying in bed. And it sounds like it's a great way to get people to acknowledge each part of their body and just relax it, and then reduce pain, which messes with their threshold in a good way,
Yeah, yeah,
probably
yeah,
reducing their
with the
pain.
neuro threshold. Yes. Yeah, that's what it's all about. And, like, and this is one thing I'll tell you what PTs struggle with the, if they still are operating on the pain gate theory system, what we really struggle with is, so, like, I'll get other PTs in community and they'll be like, so it's all in their head, because
Yeah.
there's not a tangible source, because, like, okay, like, we get kids who, like, jumped off a roof so they broke their ankle. That's tangible. You did some tissue damage, you shredded some muscle, you broke some bones, like, you probably went through some ligaments, like, that's tangible. There's reason for that pain. But then you get the kids with the chronic pain who have been in pain for 2, 3, a year, years, and they'll be like, so it's in their head, and then you have to explain. Even I get that from parents. So is it in their head? And it's not in their head. It's everything. It's this episode of pain. How long have they been in pain? A year. So that means their stress hormones are probably really high. All the neurotransmitters coming back and forth. There's probably some axonal or some neural swelling chemically. There's like all the neuroscience-y things in their body, the chemistry of the body that's off right now, plus like the mentality. If you know you're in pain, like the brain does some pretty powerful stuff. Like if you're in pain, you don't want to move, like you just don't want to do it. Like why would I move? Like why would I move?
Yeah, it's like in your nature not to move.
Yeah.
That's just how it is, especially in today's day and age. Maybe a long time ago when you're traveling in packs and you hurt yourself, you had no choice but to continue. But now it's like I could totally just get on my phone for 3 days straight and do nothing. So
why not just do TikTok in my bed during a pandemic?
I know there's so many excuses not to do anything now. There's so many excuses to develop chronic pain, people. Let's just do them all. Let's just develop chronic pain, everyone.
Well, that's what I'm like. My coworker and I, we're super curious to see how this pandemic, whenever it ends, or if it does end, I don't know, or when we get back, how many chronic pain patients there's going to be, because my husband works with teenagers, and I work with teenagers, like ones who aren't even in the chronic pain clinic, like some who come through because of, I don't know, they had a surgery or they sprayed an ankle, so many reasons, like we all work with teenagers for different reasons in that clinic. And like, they have no social, like there's been no socializing. They've been on their phones. They've been isolated. There's no school, but for good reason. I'm not being political. But I'm just saying the facts. Like we haven't been able to be social.
What are your opinions on opening schools? No,
don't ask me.
This is what this podcast is about.
This is why I have a 15-month-old, so I don't have to have an opinion. I literally, this is why I have, Trevor and I talked about that. I'm so glad Kirsten's so young, because, I don't even know. But, these kids are facing. Some parents, we have patients who are, parents are like, you make the choice. Do you want to go back to school or do you want to be online? I have some kids who are terrified of COVID. I have some kids who are not. I have some kids who are anxious just even going to the grocery store to grab something they need. So how many pain patients are going to be coming out of this pandemic? But then I also have some kids who tell me, we'll follow up with them who dropped off because they didn't want to come into the clinic because of the pandemic. Well, we'll follow up with them and they'll be like, I'm great, because you took the stressors away. You took the school stressor away. You took the social stressor away. You took the family expectations, because there is no expectations. It's a pandemic. There's no expectations. So and this plays into the environment again. What environment are you functioning in, and how does it individually affect you? And that's what the pain program at PCH is all about. It is individually tailored, and it's to meet your needs.
Oh, look at that. I feel like this is an advertisement for them. Everyone listening,
children.
Go. I know. I'm great. I'm happy that you love your job so much. This is great. And I hope Miami has an option like this for kids. You were mentioning earlier that one doctor was from Miami. Did he study at Miami, or is he born in Miami?
Which one?
The doctor that you work with, you said that he was from Miami.
Oh, Dr. Zakarian, he's from Miami. So he was born and raised there. And then I think he did, but then he went to do research in California. And then I don't know how he got to Phoenix Children's, but he went to elementary, junior high, and high school in Miami. So he's from there.
You get some of that accent. You get to hear the accent still, which is good.
Have you gone back and visited your family? Have you gone to, and we'll talk about such and such spot.
The different places. Yeah.
Yeah.
So he can relate.
How is it? Yes. How's the beach? How's the sand?
I know, true. You do have sand over there, but it's desert sand, right?
It's desert.
How far are you from the desert?
I can walk a mile. I'm on the edge of so I live in Mesa. I'm on the edge of Mesa and Apache Junction. There's some
oh wow, that just sounds
it sounds right, but no, so I live in a neighborhood. I don't live out in the middle of nowhere, but the desert, you could just walk anywhere, and it's the desert's, I mean, I live in a suburb, but the desert, literally I could drive a mile and be in the desert,
Yeah, they plant these houses on top of desert, right? And then now, but if you stray too far, the fox will get you, or what's a desert animal? The coyotes.
I
Watch
see
out for the
coyotes.
coyotes.
We have to be careful. There's coyotes that run around here because the desert is so close. I mean, literally, I back up to the Superstition Mountains. Like I can see the back of Superstition Mountains.
So you have good
People know where that
views,
is.
right? You can
I
see
have
the.
great views. It's awesome. It's so pretty. I live right next. I'm like right next to the freeway as well. The 60, the US 60. I live a mile from the US
Wow,
60, so I
great
can hop on the freeway.
location.
I know. I'm like
Boom.
selling. I'm
Everything is
selling my
within
house to you
reference.
right now.
You're
Would
selling
you like my
Phoenix.
house?
You're selling your house. I am going to
You should
work at the
move.
Children's Hospital, and I'm going to work and I'm going to live in your house.
Honestly,
Thank
I've
you
been
very
trying to
much.
get Trevor and I have been trying to get Sarah to move here for about a year and a half. We've been scheming and be like, oh, we should tell Sarah there's a sports position opening at Phoenix Children's. We should get
Oh
Sarah to move
yeah,
down
she
here.
would love. I think she would love Arizona.
Me too. You can go hiking, snow skiing in the wintertime. You can go salt river tubing when there's not a pandemic. You can go quadding, hiking, shooting. There's outside gun ranges if you're into that. There's like you can literally do anything. Hunting, you can go up north. There you can go like camping. You can go see the Grand Canyon. You can go hike some mountains up in
Do you guys have
Flagstaff.
hurricanes though?
No, we get haboobs.
What's a haboob?
Oh, I'm glad you asked. It's a huge
I
wall.
remember
You
that.
should go look up a video. It is a huge wall of just dust. And it like and
Oh my
it
God.
sounds like you're like, oh, that's nothing. But no, like if you get caught in it, it's
Haboob.
it's awful. It's a haboob. Go look up like the 2008 haboob or something, or like the 2000. I forgot what haboob it was. It knocks out power lines. It will destroy your pool.
Arabic word?
It destroys
Yeah.
stuff. Yeah,
Oh,
well,
yeah.
it comes from like the Middle East, I think.
Yeah,
But yeah.
no, that's haboobs. Well, no haboobs. So a haboob is just a dry version of a hurricane in a way.
Yeah,
Or
with
it's
sand.
like
So it's a hurricane with sand.
I'd rather have a hurricane. Well, yeah. But can a haboob like tear a house off its floor?
I've never seen it do that, but like your house will be covered, and it usually lasts like I don't know, like it's an hour sometimes, 20 minutes. Like it just depends.
Wow.
It just comes through and just wreaks havoc, and then
It's
it's
crazy
gone.
it's crazy how nature just develops these like little freak out moments. Like where
Yeah.
was that sand? It's just chilling there and then decided to haboob everyone at once.
Yeah, I don't know where it comes
It's like an
from. I have
avalanche
no
of
idea.
sand, essentially.
Yeah, it is.
It's
It
probably
is.
like stored up and then
It's so big you can see it from an airplane. Like people take videos of it from an airplane. Like it's that big. Like you can see it coming in. Like go look it up. I swear the videos are fast.
Yeah, I'm interested now. I think I might have seen some videos before on this stuff, so I'm interested to hear that. So, the haboob is a perfect segue to the next question, because pain can be like a haboob. It can come on, and it can hit you, and then all of a sudden you don't worry about the haboob, but then your pool is full of sand. You let the sand stay in the pool, and it was just the pain. And then after a while, the sand just messes up your pool for a while. And then you got to clean it out. It's a bigger job because the sand is in the filter. It's stuck in the ladder. It's denigrated the ladder.
Gross.
So it's gross. No one wants it. So, so that was a good transition, I think.
That was really good. That's borderline professional.
Yeah, that's the best I can do at this point. Borderline professional. So just to reiterate, because this seems to be the theme of the show here, is like this transition from taking people that have had acute pain, so pain that's been recent, there's a definite thing that caused it, and then it becomes chronic. So, these are key factors in time. Are there some things that you have noticed that lead to more chronic pain situations? I think we referenced this earlier, but like for example, like a traumatic accident with someone that's not active versus like maybe like a little scratch with someone that isn't, who is very active, or kids that play sports, for example, have like a higher threshold for pain because they've been through these things growing up, or does that not really make a difference when you stop moving in general?
You know what, I have so many just like, I guess, case studies or just like, I don't know, just stories of my experience. But like what I've seen is like sometimes there's not an acute injury. Sometimes it's just like, sometimes, you know what, you should go look up, what people should look up, go look up conversion disorder. That we've had a couple of those diagnoses come through. That will throw you through a loop, and that takes the whole theory of like there was an acute thing and then a chronic thing and then environment. Sometimes they're just not. Sometimes it's like some brain chemistry. Sometimes there's just life events. And then like, well, and like, I don't know, think about it. Like, you and I, we're both active. And I'll think about this on a run sometimes. Sometimes like the inside of my instep will start hurting. And I'm like, oh, like I'll probably like have Trevor like do some stuff to it real fast, or I'll do it real fast and like I'll be fine. And then I don't think about it ever again. But for some of these kids and adults as well, who are in this, like, I don't know, like maybe there's some stressors in their life. Like you said, they're going to a funeral and their car breaks down, and then their shoe, and then a dog, and then their husband wants a divorce. Like, you have like, take the environment and then add that little plantar fasciitis, like it's the end of the world. Like, and then that just trigger, and it could be the triggering event, kind of like genes, how a gene can click on. It's just a triggering event, and then they have the back pain, and then because they're limping so bad, and then the
Yeah.
back pain comes. Like, who knows what happens? And I always tell patients, I can't tell you what came first, the chicken or the egg. I can't tell you if something happened then you got the pain, or if the pain started coming and then you had something happen. I can't tell you. But what I've noticed is the patients who are more motivated and most resilient are the ones who have a goal, a set goal that they're working for, or they were active and they know what activity feels like, versus taking, like, this is where education comes in a lot, because we are such educators. But the kids who are in chronic pain, who have never been active before, and you start doing low, just even mat exercises, just abdominal bracing, and they'll be like, oh, that hurts. You have to change their language. No, it's not hurting. This is working your muscles. This is what soreness feels like. It's not pain. This is, yes, it is uncomfortable, but your body is not being damaged. There's no tissue damage being done at the cellular, molecular tissue level. There is no damage being done. This is what it feels like to work out. And like, that's where the education comes in. But a lot of the times I feel like the kids who do, I want to say, like, bounce back fast, are the ones who come through who are athletes and they have something they're working towards, or the kids who are like, I'm sick of this, I'm getting out of this, I want to change my life, and I want to get this done for the better, and I want to get over this, so please teach me. Like, those are the ones that I see, just who excel. And then you get some sad stories who, like, parents play a huge factor. And that's the huge thing where education, where the doctor and this pain psychologist come in, because I can't do it all. Like, none of us can do it alone. Like, the parent education, because sometimes you have to tell them, like, Mr. and Mrs. Smith, I'm sorry your daughter's in pain, but like, to get on this program, to get bought in, you cannot let them just sit around all day. You need to encourage them to do their home exercise, to do the methods that Dr. Zakarian is giving them, to get them doing little bits of activity that they can tolerate a day. Like, hey, let's go walk 10 feet outside down the block, not in Arizona heat because it's 120, but like, hey, let's, like, when it's
That'll toughen
nighttime,
you
when
up.
it's, oh my gosh, don't do it in without shoes on. But hey, let's go take a walk outside. Let's just go down the park and back. Let's just, not a Target run. Let's not do a Target run. Let's just walk 20 feet to the park and back. Like, that's where we start sometimes. And it takes the household to buy in. Like, the patient has to buy in, the parents have to buy in, the household has to buy in, because let me tell you, the factor that cripples these kids is if, one, they're not motivated, they're not bought in, but also, huge factor, if these parents are like, you're in pain today, that's okay, go back to bed, I won't put any demands on you. But you have to, but as a parent, like, if, like, Carson, if he's in pain, like, being a parent, I can totally get it now. I totally get where they're coming from, because when Carson, like, hits his head on the wall on accident because he tripped, like, I don't want you to be in pain. But at the same time, kid, like, you need to walk it off because it's going to happen again. Like,
I know.
like, you have to find
I
that
feel like
fine
the urge
line.
would be to be very caring to your child.
Yeah.
So
Yeah.
you're dealing with a unique situation because parents, it's so with me, it's like adults that I'm like, come on, we gotta get through this together. I'll probably do it in a nicer sense because I was trying
Right.
to
You
work with
have
them.
to. You have to.
But when you're working with a parent, it's like, okay, so now you gotta work with the kid on their thing, and then you gotta like convince the parent that they gotta stop acting a certain way that might be making the kid
Right.
worse.
It's a
And
complete
there's
behavior
total,
change.
yeah, you're like, you gotta raise your kid
Yeah.
differently, or you gotta change the way you raise your kid differently.
Yeah.
So yeah, I can imagine. I mean, like with my nephews, I like, for like wrestling, and they start, and I totally pile drive them, and he survives, he'll he'll like, if he starts whining about something that's not a big deal, like like that was a joke, but if it's not like actually something big, like come on, and that kind of they get
Right.
right over it in a second. So with
Right.
pain can be taught the same way, and like you were saying earlier about pain like being in the head, like yeah, technically you could say it's in the head because it's your brain moderates like these signals that's coming from your
Right.
periphery.
Your brain
So
processes everything.
exactly, I
The
mean
threat
it's
level.
yeah, and that's your brain's inside your head. But when people say it's in your head, they're thinking like the way they're
It's
saying
fake.
it is like, yeah, like you have
It's made
a
up.
psychological condition that you're
No.
making it up. Like
And that's what I always tell them. It's not your, I believe you. Whenever kids will come in and tell me I'm first off, I believe you because pain is subjective. I can't quantify pain. There's no way, there's a way to put on a scale and quantify it. There's no way to objectively measure pain. There is no imaging. There's nothing to be done unless I have like what a functional MRI that they do on like
fMRI.
researches. Yeah, I can't do that. So
Yeah.
pain is subjective and it's yeah, like you said, it's totally like it is like it's everything moderating like it. And I always tell them I believe you. I am not calling you crazy. I'm not calling you crazy. I am not thinking you are lying about this. I don't think you're
Mm-hmm.
making this up. They are really experiencing pain, and that's what you like. You have to educate the PT community. You have to educate the parents. They're not, and sometimes kids do, kids don't want to go to practice, so they'll say like, oh, I hurt. And I'm not talking about that. I'm talking these kids literally hurt and they feel it. Like they feel it. It's not made up. It's it's and that's what makes it hard for us to wrap our head around is because it's like there's nothing tangible. And that's what makes it hard for parents too. It's not tangible, so they don't know how to fix it. So it's like, go ahead, lay in your bed all day. Like that's the only
Yeah,
way I know
just
to
shut
make
them
it
up.
better.
It's honestly, it's like someone going to a psychologist and saying they're sad. Like you, as a psychologist, you understand that there's certain biological and psychological and social issues that caused it, and you're going to work on that.
Right.
It's the same thing if someone comes to a PT with pain, which is like kind of a similar comparison.
Right.
Like we understand that the pain, there's biological, psychological, and social aspects to their pain they're feeling, but we want to help them. But we can't go out there and say, oh, it's in your head because we know it'll be perceived a certain way. And
Right.
that might be what they're thinking when they come in. It's all in their head. And yes, it's their brain moderates a lot of these things, and we work on that as PTs.
Yes.
So we just need to articulate and we do a good job of that. I'm sure you do a way awesome job because that's like what you do all day, at letting them know that like, okay, you can get better. I
Yes.
know how you
Yep.
feel. I'm not denying the fact that you're in pain. In fact, I will agree with anything you say about your pain. If you said it feels like an elephant stepping on you, I'd be like, that's fine. That's what it is.
Yeah.
That's how it's going to be. Elephants walking on you. I believe it. We're going to work
Yeah.
on getting that elephant off of you. And it's awesome because we
Yes.
can agree with them and we can also think that it's in their brain, not their, I guess, not
Yeah.
their head in the way that they think it's in their head. So I
No,
think
it's
that's a,
not. Yeah, and so that's what like the multidisciplinary clinic, that's what it all is. It's reconnecting the mind body, putting everything together, like trying to find like trying to find homeostasis, I guess is like the word, trying to find. And like they may have some pain and it may get worse, with some stressors, and they're going to have to use it's literally you're going to have to use it. It's like school. You have to use what they give you, what Dr. Ari Zakarian gives you and Dr. Genovese gives you, and like what I give you, like you're going to have to use it. Because yeah, we can give you all these, like I have like Alexa and I and like everybody at PCH, like Alexa and I are just at Gilbert, but everybody at PCH, all the pain PTs at PCH, we have so many handouts, and like it's overwhelming, but it's like you have to use it to give yourself an edge over this pain. And so that's where it comes in. Like it's like a resource you're going to have to use, like the whole like muscle relaxing and redirecting, refocusing, because if those stressors are going to come, you can't live in a vacuum all your life. And yeah, your pain might flare back up, but now we've given you the foundation, hopefully, and educated you enough to combat that pain. And if you need me, come back again, but hopefully you don't. And hopefully you can combat the pain and be functioning again and be an independent member of society.
yeah. I mean, do you see what percentage of the kids that you see have chronic pain conditions that are relatively, I mean, permanent, or like things that are like more like systemic issues,
I
Or have
don't
you
know.
seen
Like,
a lot of people being able to get better no matter what the cause? I mean, you were talking about things as weird as stomach pain for no reason. So, I mean,
yeah,
I guess you have
like
quite a range. You have
I've had,
movement-based
yeah,
musculoskeletal pain that turned into chronic pain, and then you have things like stomach pain, which you can't really explain. Are these
yeah,
are these things that that have a surprising amount of similarities in their treatment, or
yeah. Well, like parents will be like, oh, they had a new pain today. Like they have this pain that popped up. That doesn't change my treatment. Like I take them through a graded dosing exercise that they can tolerate at their level that week. And hopefully you're doing your
Mhm.
homework for your week, because guess what? Week 2 is coming, and week 2 is a progression of week 1. And guess what? Week 3 will be coming, and week 4 and week 5 and week 6. Like, so it's graded. It's all research based. Like Alexa and I, like everybody at PCH, we have done our research. It is graded. It is dosed. We take breaks if we need to. We kind of try to move you away from breaks as we go. Like, just throwing that in there, but don't tell me that. But but we give grace. But like, but like I've seen so many people, so many kids I've walked through, and like the worst, where they're describing stuff that, like the elephant, and I'm like, I don't even know what that feels like. And you're overwhelmed by what they're telling you. Like, as the evaluator, you are like, goodness gracious, I am so overwhelmed. But it doesn't matter, and it matters at the same time, because guess what? Your pain, I'm going to treat the same way, maybe a little bit different. Maybe we'll do a couple different things, because your stomach pain, like, we need to get some rotation in that abdomen. We need to get the abdomen working again, because you're probably avoiding using your deep core, and you're probably avoiding using your core because of that pain. So we need to get your core stronger. So, like, there's little individual things, but
Yeah.
everybody goes through a structural PT dosed exercises that starts from the core, builds its way up. But I care about your pain, but at the same time, I don't care what it is, because I am going to treat it and run you through the program with a little bit of individualized twist, because I care. I deeply care. But we are going through this program just like everybody else is. And like, it's a structure, and like with room to individualize. But pain is, pain is pain, and we're trying to move you out of it. That is the goal. That is the goal.
Yeah, it seems like, I mean, that's for any PT, that's the goal, but with the chronic pain, it really becomes a whole experience. It sounds like you're combining a lot of aspects of traditional physical therapy, which
Right.
is based in a lot of research, obviously, with with these concepts that are more related to pain neuroscience, which at
Yeah.
this point look, I mean, from a layman's term, they look a lot less technical. Like you're saying earlier, if we wanted to be super technical, we could get so granular with like the joint movements and every little nerve being hit, and then you could convince someone of that, and if you do and you can make them feel better, they'll think that that's the exact reason that they got better. but
Right.
but combining pain neuroscience with this more musculoskeletal approach, and honestly, pain neuroscience isn't like its own, it should be just included within that, and that's what it is. But I'm
Me
just
too.
saying, um, that's how people view it, at least. It is a combination of things. And one particular interesting thing that you brought up is graded exposure or progressive exposure. Like, can you explain that a little bit for the listeners? Because I think that's a huge concept of pain neuroscience that everyone can use.
Right.
Because with graded exposure or progressive exposure, that's the whole concept of introducing someone to something that they're fearing. So I'll let you take the
Yeah.
rest of it though.
Well, so a lot of I'm going to be honest, shout out to Adrienne Lau, Dr. Adrienne Lau. So my coworker who I've done that started this pain, who's involved in the pain clinic with me, we both work together with the multidisciplinary aspect. Um, he came to NAU and did a guest lecture. And so that's how she knew about him, because we both got
Mm-hmm.
put in there. Like, we got hired on at PCH, and they're like, do you want to do the pain clinic? And we're like just out of school, sign me up. Like, yeah,
Yeah.
I'm ready to
Yeah, we're
learn.
so eager to
Yeah,
learn.
put me in, just put me in, and I'll succeed. I probably sank a little bit, I'm gonna be honest. I sank probably the first little bit, but you know what, like, taught me well. I just kind of swam to the top. But so we did a lot of research. We read his text, we're reading his textbook. He has like a short, like, it's great, like maybe a 45-minute read handbook of common knowledge, probably at an eighth grade level, of what pain neuroscience is. And there's one for the patient, there's one for the clinician, and there's also a workbook. It's awesome. Go look up Adrienne Lau if you're a PT who has like chronic pain patients. Adrienne Lau, he's awesome. and his stuff is on Amazon. It's great.
He wrote,
So
he wrote a book called, I have it right here, I think. Explain Pain. Was he involved in
yeah,
that? Oh, that was David Butler, Lorimer Mosley, are these other two pain neuroscience guys that, and I'm sure
he
Adrian Law
probably works with
contributed to
them
this.
because
Yeah, because they're
it's
all
a
Brits.
cohesive work. So Alexa and I read his work, read some of it during the pandemic and before, but we put mostly Alexa did a lot of the work. I did a lot of it's a tag team effort. But what we came up with
Yeah.
was this: we needed to start at the core. What we realized, and what this goes back to what you asked me about, what's the common theme you see? No one has a core. No one uses their core. So we had to start at the low. So it is basically week one is is functional activity with abdominal bracing, like finding that transverse abdominis, because there's so much research on the transverse abdominis. That thing is a huge driver of breath. It's a huge player in pain. It's a huge driver in core stability. So we always start with the transverse abdominis, and we'll do like bracing for. It takes people sometimes 20 minutes to find that TA. It's crazy.
How
No
do you
one
cue
uses
it?
it.
What's the best cues for you? This is like
What
the
I
ultimate discussion for PT.
Oh my gosh. So I poke. I'm a poker. I like manual.
Oh
I'm like
God, how
tangible.
dare
I know. I'm like, it's right here, and then I'll describe it. It feels as if like if it's a guy, like I'll say, like, you know how like someone, like your brother's gonna rush at you, or someone's gonna punch you, you know how you tense up? That's that feeling. Or if you're lifting a heavy box, like that's the feeling you get, like, that grunting, that like
you?
like, that,
Yeah.
yeah, where you're holding your breath, like lift, like you're moving something heavy, like a couch. And they usually get it after that. So that's how I cue it. But then like we'll do like just easy bridges, like, or we'll
Mm-hmm.
like, that's week one, just easy, like there's 4 exercises all about the transverse abdominis. Week two, still mat, but it's more like transverse abdominis bracing two with a little bit of glutes and hamstrings. And then week three is on built on top of that, where we're doing single leg group bridges with like transverse
Oh.
abdominis bracing, and it goes from there till like week five, we're
Progressively exposing them.
progressively, and to where they know, they don't even I don't even have to remind them to brace. They already know where it's at, and they can tolerate the high level plank. They can tolerate standing eccentric toe tacks, like stuff like that. That's just how we work it. We start from the mat supine and work from there.
Yeah, and this is once again the concept is like whenever you're in chronic, let's say like every physical therapist in the world disappeared. We all went to Mars to discover some aliens to help. If you had to figure out one thing to get yourself out of pain, it would be like start easy and progress it to hard. And
Yeah,
that's the easiest way to put it.
yeah, that's what we tell everybody. Like, I'm not like, I have some kids who are like, I want to go back to running. I'm like, okay, that's great, that's awesome, I love that you love to run, but we're not going to be running a mile tomorrow. And if you do, I'm going to advise you against it, because we have to get you there slowly. We have to build you back up, because I'm here for, honestly, I'm here for two things. I'm here for their betterment, and I'm here for their success. And I don't want to put them in like, oh yeah, go run a mile in 2 weeks, like, you go for it, Zach. Like, I'm not going to do that to them, because they're going to backslide and then be in even more pain, and
Yeah.
their outcomes are going to be bad. Like, I'm basically setting them up for failure. Like, I'm not going to do that. Like, they'll get so motivated and so like wanting to just move, and you can't do that. It's got to be over time. We'll come up with a program, like when we get to week 8, let's start doing a walk run program, let's start doing a walking program, let's start doing a walk jog, let's start doing a jogging. Like, you got to work, you have to start small. You can't just go into it.
Yeah, with my patients, if I'm viewing this in a long term concept, like if I see them hit various milestones, like all of a sudden after a couple appointments, they've really made progress on their knee flexibility, and they can actually jog pretty well when they notice themselves jogging up the stairs, and they go, hey, like I'm thinking about going for like a little jog, and although like I wouldn't do that in the
No.
clinic yet, yeah, although I wouldn't do it in the clinic yet, like over the next few weeks, I know what they're thinking, and I'm like, okay, we can start probably letting them try these things in the clinic, and
Yes.
then because they notice themselves like, oh, I was running, like I ran out to the mailbox and I didn't even realize it, and I'm like, I won't be like, why did you do that? Oh my God, I'll be like,
Yeah.
good, like
Yeah.
you gotta give that positive vibes because they already did it,
Yeah.
so you gotta
Like,
be,
that's
well, yeah, that's
awesome.
good,
Good
yeah.
job.
Now we're gonna work towards that, and like and honestly, if they tell me like that weekend they went for like a run, even though I didn't like advise for it, but it worked out fine, then I have like a new time frame in my head. I'm like, okay, well
Right.
now we could probably get to that way sooner. Now they already went for it, they're fine, and sometimes you can take some of those setbacks because if it's a little baby setback because they went for something,
Yeah.
but they feel good about it afterwards, then I'll just frame it as like, that was great. We noticed something, but let's just change this up a little bit. So it's all about being like a movement optimist in that sense, and framing things right, because it's a total psych game at times, trying to work with people and convince them and have them understand from the inside out that like movement is good, and that
Yes.
but too much too soon is not. So it is about being progressive, and that's
Right.
what the graded exposure, progressive exposure comes from.
Right. And it leaks into their function. Because in pediatrics, you're all about being functional and all about being like independent community, being back in the community, being part of the community, being a kid again. So, like, I'll have kids who, like, can't even go on a Target run with their friends. So, and they're anxious about it. Like you said, but then I'll have kids who will come, like, it'll be like week 3 or 4, and they'll be like, hey, guess what? I'm like, what? I went to Target this weekend. That's awesome. But I used what Dr. Zakarian told me and what you have told me to like take rest breaks. So like we would stop and I would sit and like try on things, or like we'd take breaks by like, like they figure out a way to sit in, like to fit in rest breaks. Like,
Yeah.
oh, my friend wanted to go try on this bikini, so we went to the dressing room, and I got to sit on the bench, and I lasted because I took graded rest like we've been doing in PT. Like, you work out.
Oh, it's
They're
adorable.
essentially taking your
They listen
PT
to you.
session and putting it in the world in Target. Like, we're going to do
Yeah.
exercise for 10 minutes. Oh, let's take a break. Okay, exercise. Like that's how it in pediatrics, that's how it translates. Like, like, adult world running, that's how it transfers for pediatrics is, can I go to the movie theaters? Because these kids, they get anxious. They're like, I literally had to call my mom to come pick me up because I cannot make it through my day. Like, that
Oh.
to me is so sad. And that's like what we work hard for, is to get them back to being able to go to school, be able to do that sleepover, be able to go to that, I don't know, function they want to go to, prom. Like kids who I can't even make it through a prom. Like, that's what we're working with. I don't know. It's so rewarding. It's so fun. I love it. I love pain. I love pediatrics. I love working at PCH. It's been a lot of fun. I miss Miami, but I love my job down here, out here.
No, I feel like where you're at is much more of a, it fits you. It's a family vibe, and it's not, you're not trapped between gators. There's not
I
gators and
know.
hurricanes hitting you, but there are coyotes. So watch out for those guys. Watch
Yeah.
out for the coyotes. I feel like I should have a piece of something in my mouth. Those things that the farmers have, but the country stars have them too. And then a cowboy
Oh,
hat, and look off into the sun.
the grass
The
thing.
grass.
We
Yeah,
don't
the
have them out
old
in
school
Arizona.
grass.
That's like Midwest.
Is the grass soft over there, or do you have turf?
Um, we
Or do you
have
have
mixed.
hard Miami grass that feels like knives?
Oh, no. Well, sometimes it depends on if the ground's hard. We have hard ground out here, and like it'll get compacted, like especially with irrigation and drying it out over the summer. But we have like grass that's fine. Like, it depends on where you live and how much you're willing to pay for your grass
Um,
and how much your HOA pays. But we have like the turf, but it like burns your feet. Like, if you have the fake grass, you have to water it down, or else it'll burn your
yeah.
feet in the summertime. It hurts. It's
What
like
happens when a
pig
dog goes
decking.
poop on it?
Oh, I don't have it, but my friend, she has it, and she has a couple pit bulls, and she has to go out there and sanitize it, and she has to go up and pick
Oh.
up it up so the sun doesn't bake it on. This is disgusting, but yes, don't get fake grass in Arizona.
I
Ugh.
have like
Unless
a
you don't have a
irrational
dog.
fear of stepping in dog poop on grass. Like even in my backyard growing up, I had a couple instances where I like fell right in it. And now whenever I'm
Oh,
barefoot on grass and like running around playing like in my backyard when I go home, I'm like I'm gonna step in some dog crap, and I'm afraid that this is gonna. It's just like I can't really enjoy myself. But laying in the grass in Miami, I get like it's like sharp. I get a lot of allergic responses to it too. So it's
yeah, I still do too, even here.
I know. I wish I was grass resistant. In like another 150 years, our bodies will adjust to hopefully. Maybe you should do
Maybe.
some graded exposure. Maybe
I
what you
know,
should
that's what I think. Maybe I should.
get like different types of turf in your yard and then lay on them progressively until they get easier to lay on.
I'm doing that with Carson with food. Because they tell you to start giving like kids peanut butter at like 6 months old, like start progressively giving it to them, because like, like the top allergenic foods. So I've been like trying to like he's a peanut butter fiend now, but like he like that's what we would
Too
do. Like we'd
much.
like you just like give him a little bit and you're like, okay, is he gonna break out in hives? Like, do we need to call 911? And then you like give him a little more. And then like 10
Um,
months old, you give him like a little like baby
Same
spoon.
concept.
Same
It's the same
concept.
concept. Yeah, it's like the body likes to be exposed to things slowly, and when you're in
Yeah.
pain, it wants to get out that way. Last thing, do you ever take the peanut butter and rub it on the roof of his mouth so he's just like
He's
a
got it
dog?
stuck up there, and my dogs. It's really funny, but it's so bad. But yeah, he's got it stuck up there before, like peanut PB and J sandwiches. And he'll like look at you like like the look on his face is like, what did you do to me? You're like, I'm
Yeah.
sorry, just get it off your mouth. And you're like trying to stick your finger in there, and he bites you. It's just a
Oh.
mess. It's a mess.
Babies' reactions are always they're so honest. Like,
Oh
it's
yeah,
like, why, mom? Like, I hate you now. Like, it's over. But then they're
yep,
still in their stupid chair. They forget 6 seconds later. And then,
yep.
then you always win them back. That's the beauty. That's why I can't
That's
wait to have
it.
a kid.
Yeah. I don't
So I
think I
get
can
away
mess up
with
at this
being.
age because, like, yeah, you can't mess up because, like, you know, if I do something like I've messed up really bad. Like I've accidentally clipped him. You know, like the buckle,
Oh,
the
yeah.
like to
That's the
I've
worst.
accidentally I was in a hurry and like I was trying to get him in really fast and like just to
Yeah.
look like I didn't make him bleed, but like he screamed and I felt really bad and I was a bad parent. Like almost to the point I was like, Trevor, they're gonna call CPS on me if they see this right here. They're gonna see
You
this.
clipped
But
your
like
child.
I know, but like, but he didn't remember. He probably won't remember when he's 21. Like,
No.
you can't mess up at this age. Like, when they start becoming cognizant, then like, I feel like I'm gonna have to get my act together. Like, I'm gonna have to figure this out real quick. But like, yeah, right now it's like, it's a free for all. Like, we're just trying to figure it out. He doesn't even
That's every
know. He doesn't
parent. Yeah,
even
that's what
know
I
that we're
hear.
messing
You're
up.
probably
I'm
like
like,
the world's
awesome.
best parent. You're way too judgmental on yourself.
Yeah.
Yeah, it's like just like with pain. We're gonna bring it back again and keep bringing it back. It's if you keep clipping him every day for 6 years, he probably develops some
It's
chronic pain.
awful. Probably.
Yeah, by mistake, not like some weird 1980s experiment where
Right.
it got determined that it was like some kind of illegal. It's gonna be in our textbooks in 30 years, like with all
Awful.
those other studies that were done with terrible. What's the word I'm looking for? Morals, terrible
Oh yeah, like no ethical, no
ethics,
like
ethical
yeah, no
violations.
ethics. Oh,
Like they would
awful.
pet they'd have like the little soft thing, and then they would like scare them whenever they touched it, and then the kids,
Yes.
yeah, that's terrible. I mean, yeah, because
Awful.
you do things when you're a kid. It's like the butterfly effect. It's gonna become a
Yeah.
bigger deal when they're older. Well, this was a great episode. This might be one of our longest
I know.
episodes, and
Sorry.
it felt like no time. No, that's good. It was a ton of good information. I can't wait to cut this up and put it all over Instagram.
I'm
If I had a
sorry.
TikTok, I would put it on TikTok.
Oh,
Um,
okay.
if I did, I don't. I don't want China
I,
knowing this information.
I don't have TikTok. I think it's from the devil.
Why? Because it's this
It's,
dance.
my husband has it, and it's such a time waster. That's my mom. That's my mom platform. TikTok is awful.
Your
It's
mom
funny.
uses. Oh no, she
It's
doesn't
funny.
use TikTok.
My mom
She
does not,
does.
but my mom does not. Are you kidding me? She probably has no idea what TikTok is. But my husband has it, and like, so but we're like, it's literally we waste like 15 minutes going to bed at night because we're like, oh, let's look at this dumb thing. And okay, yes, it's funny, it's hilarious.
Yeah,
There's some great
sometimes it
things on
hits.
there.
Sometimes it's funny.
Yes,
It's
but
like
other times I'm like,
Instagram, but it's
ah,
like it seems like it's Instagram, but like it's even easier to infinite scroll, and their algorithms like push you like
oh,
so to what you want. Like Instagram gives you a lot of stuff that sometimes you're like, but then it's because you follow the wrong people or you didn't unfollow someone. But it seems like I was looking through my buddies and he had it mastered. Like it was all these cool videos.
oh,
So I don't know. I guess you gotta be smart with how you ride that algorithm. But
I am not.
uh, yeah, you'll end up with like the things you don't like. It'll be like how to be in pain, some kind of pain fiend.
I know.
Because you said you loved pain earlier. That was interesting. It's very suspicious coming
I
from
like
a
I
pain
like the
doc.
pain research.
It would really benefit you if everyone was in pain. But me too, though. That's the thing. And when everyone gets in pain, there's always those PTs that are like, "Oh man, like after the hurricane, a lot of injuries from like fixing up the house. Like we're gonna have a lot of patients this week." And I'm like, "Yeah,
I can't believe
technically."
people say
Yeah, sometimes I'm like, are they excited for it? I mean, after coronavirus with all the with no one coming in for PT,
yes.
it's like you get all these people coming in now because they're feeling a little better about it, even though Miami's like the hub of freaking coronavirus in
Oh,
America.
us too. Are you kidding me?
Oh
We're
yeah,
right
you
up there with you
too.
guys. We're a hot spot.
It, uh, the peak is flattening. We
Yes,
look like we saw the peak, so hopefully we're on the other side.
I hope so.
Yeah, we'll open back up pretty soon, hopefully.
Well, this was
But
great.
thank you
I
for,
had so much
yeah.
fun.
Yeah, wasn't it pretty natural? You're such a
Yeah,
good talker.
I've been waiting for this. Oh no, I'm not. I've been waiting for this all day. It was so fun. I was like, it's 5 o'clock. It's
Oh.
5 o'clock.
I know, like at 8:01, you're like, I'm on Zoom, I'm waiting.
I'm here.
I should have been a good host. I should have been on 7:59. But thank you so much, Dr. Rachelle Cherryholmes. 12 letters in
Yes.
your last name, and you have 8 in your first. That's a 20-letter situation going on there. I think I have the
Guess
same
what?
20 letters altogether. Wait, no.
Oh
I have
yeah,
12.
Robert.
Robert. Yeah, I have 13 maybe. Who'd have? Yeah, but you have 20. I got confused again. But yeah, thanks for coming on very much. If the, I hate to put you in this position, but I think it's good to end the episode with like one take-home point from the guest.
Okay.
And so think as I ask the question. Like if you had one take-home point for a mother or father of a kid who has some kind of pain condition, chronic pain, like what's like the number one thing that you see that you're like, I need to tell these parents this. I wish they knew this before they came in. Their kid might have came in a little bit better. Like how to deal with their situation.
Movement is best. Go get that PT evaluation. Don't put it off. Or like go find a pain doctor. Like you're not overreacting. Go get that eval. Go find someone who cares, who like is invested, and it's not in their head the way you think it is. And it's not, and don't get frustrated because like this is complicated. Like this is a complicated thing. And be open to psychology. Psychology is the best. I love psychology. Like
Yeah.
having a therapist on retainer is like everybody needs one. Sooner or later, like it's just a thing of life, you know? Like it's not nothing to be ashamed of. You're not crazy. Like
You go to
psychology
the
is needed.
gym, you get a personal
Yeah,
trainer. Why not
yeah,
have a doctor level brain trainer?
yeah. You need
So,
someone to
and
help you
that,
with the
yeah.
mental game. So
Okay,
that would be my
well,
take home.
yeah, that's good. A couple take home points. I can't wait to review that one. That's good. Thank you so much for coming on. And I think in the future, I'd love to have you on again. Especially, you can have you on with Sarah because you guys are friends
Yes.
and we're all friends. And then we can, and you guys have a lot of overlapping concepts, so we could actually have like a productive episode. That'd be
Oh my
interesting.
gosh. It'll be
Actually, a
like
productive episode.
2017 all over again.
Our dreams come true. No
Oh,
coronavirus. And then we could
back
warn
to
the world, and
normalcy.
we could warn the world like in October of 2020.
Yes.
Like, don't do it. October of
Put
2019.
masks on.
Get out of here. Get those bats away. We don't need it.
Shut
Okay.
the border
Well,
down. Shut the border down. Shut it
yeah,
down.
right. Shut it down now. They're like, oh my
Just
God,
shut
this
everybody
person.
down. Shut it
Yeah.
down.
They'll be like, okay, you don't want anyone coming in, and then all of a sudden you're like, told you. Should have
Yeah.
listened to me. Well, yeah, thanks for coming on, and I can't wait to chop this up. A lot of good points you came up with, and we discussed. So remember, people, don't be afraid to learn a little bit. Don't be offended when you learn that your pain might be coming from right up here, but in a different sense than you might think. That's how you
Yeah.
take care of things. And progressively expose yourself slowly to things that are scary with everything in life. That sounds very
Yep.
psychological. I'm no psychologist, but I'm saying that's a good idea.
I
Thank you
believe
very
it.
much. And Dr. Rachelle Cherryholmes, thank you very much. Have a good day.
Hey, you too.
Bye bye.